Measles is a highly contagious illness that can cause symptoms such as fever, runny nose, cough, diarrhea, just to mention a few. It is caused by the measles virus. It can also be called Rubeola, red measles, or 10-day measles. When measles is left untreated, it can cause complications such as brain inflammation or pneumonia. Today we are talking about measles. Stay tuned and enjoy the video. As I said earlier, measles can also be called rubeola, and this is not the same as the German measles or rubella. Measles rash usually starts as a flat spot on the face. It appears red on a lighter skin and could appear purplish on a darker skin. It's usually very difficult to notice if the person is very dark in complexion. The rash may spread downward the neck, the back, hands and feet, and there might be some areas that are raised bumps. It doesn't really itch. It is an airborne disease, meaning it spreads through the air when an infected person coughs, sneezes, or talks. The airborne droplets can remain in a room for as long as 2 hours, even if the person with the measles is gone. The droplet can land on surfaces that we touch, and touching such surfaces containing the virus can let you catch the infection easily. Also, being around people with measles, such as sharing foods with them, hugging them, or kissing them, can let you have it easily. Measles can also be spread through vertical transmission. This is whereby a pregnant woman will pass it on to the fetus or the baby during pregnancy, delivery, or breastfeeding. You are at risk of having measles if you are older than the age of 20 years or under the age of 5, if you are pregnant, or if you have a weakened immune system. When measles is left untreated, it can cause complications such as laryngitis, that is inflammation of the larynx. It can cause dehydration from severe diarrhea. It can cause pneumonia, blindness, encephalitis, or brain swelling, but this condition is rare. It can also cause death. Measles usually last 10 to 14 days if you don't have complications. Also, if you are pregnant and have measles, your baby could be born preterm or have low birth weight. There is no specific treatment for measles. Treatment focuses on managing the symptoms of the condition and preventing complications. Supportive care we also give include encouraging rest to help the body recover, encouraging the intake of more water for hydration, and then fever reduction or managing fever with prescribed analgesics. We also offer vitamin A supplementation to reduce the risk of complications and death from measles. The most effective way to prevent measles is through vaccination. And here again, the MMR vaccine, that is the measles, mumps, and rubella vaccine, is very effective in the prevention of measles. As a mom or a parent, you make sure your infants and toddlers get all their immunization schedules. The vaccine is a 2-dose schedule, typically given to children at 9 months and 18 months respectively. However, recent nationwide immunization exercises have targeted children between 9 months and 59 months to boost coverage and prevent outbreaks. Additional preventive strategies include good personal hygiene, avoid close contact with individuals who have measles, and if you have the measles, you make sure you stay at home in order to prevent the spread of the illness. Always remember your health comes first. If your child or you know any relative that is experiencing the symptoms of measles, you better seek proper medical intervention. Till we see you in my next video, be good.